Tell me first about your symptoms now. What is bothering you now? How is the pain?
Pain hurts.
Mm-hmm.
I can bend over, but to get back up, I have to go real slow. Because if you go fast, it tweaks it. Something happens, and then all of a sudden, my back just goes into spasms.
1 to 10, how bad is the pain when
it shoots to a 9.
9.
It'll go from a 5 straight to a 9.
How long has it been like this? How many years? Let your brain help you here. How long has he been suffering like this?
A long time. Over 15 years.
Over 15 years.
So it's about 20,
25
20 years.
So it comes back and forth and it hit you, and in this time frame you have seen lots of doctors, lots of even surgeons, right?
Yep. I went to one pain management place in Sartell. They took pictures, x-rays and stuff like this. And then they gave me, prescription, Percocets to start with. And then they did the injections into my spine. I went through
many injections.
Many of, and they said to always wait 2 weeks and you should start feeling a difference. Never felt difference. It never took, whatever. So I told them that's when they put me on Percocets at a high dose, and that seemed to take the pain away. Was on that, still on that.
Yeah. This process has been going on for 10 years or more so? 10 plus years. That you go to pain management, you get some treatment, and it just goes back and forth, and the problem just doesn't go away.
Right.
Okay.
They just ask me, how am I doing?
Yeah.
What's your pain level at?
One of the problem is that, I'm going to turn around and look at the MRI with you. If you look at your MRI, in a initial look at that, it doesn't look bad. If I wasn't, a specialist, I would just look at that. I would say this is up, down, front, back, bone disc. Yeah, the lower disc has a little lower white in it, meaning it has a little less fluid in it. Fluid for a disc is like air for a tire. But not super bad. But me as a specialist, I say, symptoms. Your symptom correspond to that level. Let's look more carefully here. And even in this picture, if I go around here, right, one picture in one slide, I see a white thing there that doesn't belong there. Specialist knows we call that a pars defect. That part of the bone is missing. In a situation like that, you see, there's only one picture that you see that. So it's so easy to miss. But the problem is here, this picture was 11 years ago. This is actually 2011. This is almost 10 years. This is the picture from December 16 of 2011. Okay? So
they've known since then.
The thing is that you see that only in one picture. So this is a problem. Even, the doctors, if you don't do what I'm doing, and you don't correlate the pictures with the patient, you can miss that. That is nothing unusual. But that's where the Inspired Spine protocols comes in. In your situation, we would always get a CT. You never got a CT. In 10 years, 20 years, you never got a CT. You cannot miss that in a CT. These pictures, this pars defect, it is like day and night on a CT, and that is what the protocols come in. That if you don't get the answer, you don't just stop at one point that, I'm all right, nothing wrong, go away, go back and forth, get the medication, get the Percocet, let me dry needle you, and so on and so forth. You put a protocol in place for difficult cases, because if it was easy, that would be fixed
a long time ago.
But finally, somebody found out what's going on. So, without saying any names, so what did that person, the surgeon, offer you for surgery?
I'm pretty much stuck between a hard place and a rock.
Yeah,
he says that I need to get my weight down between 290 and 250 for them to do the surgery to go.
Because they want to open up your belly.
Yep.
And then they want to do what we call anterior lumbar interbody fusion, OLLIF. where we cut open the belly, push the organs to the side, go to the front of the disc, they get the bad disc out, put a spacer in, and then we still, most of the time, we turn you over, open you up from the back, and put screws in the back. They didn't say they are going to do that, right? They said you have to lose weight before they can even do that. So they said this is what you
They've been saying
need.
that for years too.
Yeah. They say, this is what you need, but we cannot do that unless you lose
Wait.
so much weight, that much or
Help
that
him
much
lose
weight.
If he
Yeah.
can't exercise
Or do
because of his
anything.
back.
So do you think is realistic for you to, first of all, you have pain, you cannot exercise, and then it's sort of catch 22. So in a way, everybody knows you need help, but
Yep.
they put the ball in your court. They make you responsible for, doing something that is almost, for most of my patients are telling me, it's impossible. How am I going to lose weight and you said you even eat only once a day and so on, but these are important factors here. What are you looking forward to if once we fix you? What are the things you wish you could do and you cannot do?
Go back to working on cars, be able to bend over and pick something up, be able to go in the store and buy the big bag of dog food and carry it out myself instead of my girl have to carry it. She carries everything. People look at me, it's like, I can't be doing this.
Yeah.
She has to.
Yeah.
So she's stronger for it.
Then you have to promise me once you are fixed, you send me a picture of you doing that. And she's looking at you. Okay? Okay.
That's not a problem.
Okay. Well, thank you so much for the interview. I appreciate it.